Yes. So, and I think that what healthcare reform is showing us is that it is about who gets to control our bodies, right? Is it government? Is it ourselves? Are we able to make the decisions that are best and safest for us? And I think what else healthcare reform is showing us around those three issues: immigration, right? A lot of federal health insurance programs will not let people, even those who are in this country legally and have papers, to have health insurance for the first 5 years under public plans. Are they going to include that? We already know that people without papers are not going to be covered. And what we're finding is we've had common enemies for 8 years, and we really know how to respond against common enemies. We know how to throw a fit. We know how to get the press involved there. We don't quite know how to deal with lukewarm friends. And it's a really difficult conversation that's going on. We were all so excited when Obama won. I mean, sobbing on the floor, couldn't believe this moment was happening. Excited. And now he's doing some things that aren't making people happy, and he's being very, it's one thing to go up against George Bush and to know what you're getting into, right? You've got nothing to lose. But when you're talking with someone who does invite you to the White House, right, who you do get to have meetings with his staff, who you do get return phone calls with, who will hopefully be in for another 8 years, how do you hold this person and their administration and the Democrats who are in power in Congress, how do you keep their feet to the fire at the same time not ruining relationships with them? And I think it's something that we're all struggling a lot with in the LGBT community, in the HIV/AIDS community, in the family planning community. And you can really see it around when they passed the economic stimulus bill. The first thing to be cut was the family planning money. The second thing to be cut was HIV/AIDS, and LGBT wasn't in there, so therefore we didn't get cut.
I read an article that Obama raised the cigarette tax, and that funded immigrants and not legal residents abortions, and it was one of the first things he did.
The federal government can only pay for, correct me if I go wrong,
Or maybe legal immigrants, but
they can only pay for public abortions in the case of rape and incest, and that's not something that he has a power to change, right?
Yeah.
Yeah. So he could have, but he didn't. He doesn't have the power to do that, right? And that's the other thing that we're finding is that these things that we thought like don't ask, don't tell, why hasn't Obama overturned it, is actually not in his power to overturn don't ask, don't tell. So, right? Yeah. Like lawyer in the house, very. I mean, so it is this thing of what do we ask for? Back to healthcare reform. And what else we're finding is that Obama has a lot of public popularity right now. So he's doing what anyone who's good in politicians do. He's using that to get through major initiatives. So normally something like healthcare reform is a multi-year process where you get a lot of time to weigh in, you get a lot of time for meetings, and that's being shortened. They want it done by the August recess, which is August 7th. Right now they're talking about September, some people are saying October, but that's giving advocates like myself, 24 hours to respond to an 800-page legislation, get that out to our membership, read that entire thing, dissect what it can possibly mean. And I'm not just making this example up, I'm talking about what came out Friday from the House Energy and Commerce at 752 pages for us to have comments in by today. So what does that look like when you have to respond really, really quickly? What else is making healthcare reform really confusing is that it is so broad and it is so huge that we're having 5 different pieces of legislation come out around it that are going to be combined into one. So you have 2 pieces coming out of the Senate, 3 pieces coming out to the House, and you have to read each of these and respond to each of these and where they overlap or who's going to be an advocate. So for example, on the Senate side, you have the Finance Committee, which is traditionally much more conservative, and the Health Committee, the Health, Education, Labor, and Pension Committee, which is Senator Kennedy's committee, so therefore much more progressive. Yet neither, Finance didn't mention LGBT at all, Health only did in one section. And the other big issue is that as you're pushing healthcare reform quickly forward, really, really fast, it doesn't allow, because they want it to happen fast, it's glossing over a certain amount of details. So things like immigration, so things like abortion decisions. If we have a large if we have a large financial coverage, are they gonna cover women's abortions? Is there gonna be a medically necessary test? What can that look like? There's a couple issues that stick out as a little bit more LGBT than others. One is data collection. Federal health basically works in a system where data collection is the foundation of everything, and from data collection will come funding and programs and representation on different committees that have to do with healthcare. There's no federal health survey that asks about the sexual orientation or gender identity of the recipient. So we have no idea what our data looks like. What we get are things from LGBT PhD students who put out surveys in the field, right? Thank God we love education in our community. And we get state level surveys, which doesn't really fly on the federal level. So what we've been pushing for in each of these bills is that when you're talking about data collection, it looks like you have to have sexual orientation and gender identity. The other place where it's particularly us is around health disparities. What you usually see is racial and ethnic, and that's where it ends. And sometimes in DC, in a lot of spaces, you end up what I think of as playing disparities pie, right? Like if we come in and eat a slice out of that disparities pie, then there's less disparities pie for everyone else. Instead of talking about to be a person of color and to be LGBT, you can have double the level of health disparities, right? That you can't separate out parts of people's lives. I can talk about the differences in class, what it means to be rural and LGBT, what it means to be disabled and LGBT, and to try and weave that in throughout. And what this leaves us with is pushing to do education around this issue, and at the same time pushing to get language into legislation. And that's exhausting and very difficult to do. The coalition put out a list of a guideline for what LGBT inclusive healthcare would look like, and they were handed out earlier. I'm gonna take you through them very quickly.